Assalamu alaikum. Welcome back from the ad break. You are still watching Prime Life. Now we have with us this evening Professor Anwar Hoosen, who is the IMASA representative, who will be speaking to us about, the IMASA's updated measles vaccine statement with a growing concern about recent measles outbreak in South Africa. IMASA has taken a proactive stance, providing guidance to Muslim communities on how to navigate the vaccination process. Now, our guest today will be sharing the association's recommendations and outlining how healthcare professionals can play a vital role in raising awareness and encouraging vaccinations. Assalamu alaikum. Jazakallah so much for joining us, Professor Anwar, and welcome to Prime Live.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Shukran for the invitation. It's a pleasure to be on your program.
It's definitely an honor to have a discussion with you. Now, for those who may not be familiar with what's going on, can you tell us exactly, or walk us through the recent measles outbreak that's going on?
Okay, the first thing, measles is a very serious condition, and it has a lot of uh, effects in terms of morbidity and mortality for humans. And worldwide, there are outbreaks occurring, and they occur sporadically, in different parts of the world for various reasons. And currently, we are having an increase in the cases in South Africa. So how do we know there's an increase? Because the disease is what is called notifiable. If a doctor or a nurse or so comes across or diagnoses a patient with measles, they have to report that to the Department of Health. If a laboratory identifies a patient having measles, they have to notify the National Institute for Communicable Disease. So currently we notice now we've been informed by the NICD, that's the National Institute of Communicable Diseases, that there's a spate of infections, specifically in the areas of Johannesburg, Pretoria, that's in the Gauteng region, and there's a pocket of infection in Free State, uh, in terms of a particular district called Putswa district. Anyway, that's localized there. But in Johannesburg and in Pretoria, in Tshwane, there are a number of cases. And there's a concern that if this spreads, it can cause a lot of damage in terms of human morbidity and mortality. So that's how we know there's an outbreak currently, and that's been reported, and that's why the IMA again put out a information in terms of updating the ones which had previously, which we had put out in previous years, and they were updated recently, but this is the latest one put out now in August 2025.
Thank you so much for giving us insight on that. But with measles being highly contagious, we know that the role of healthcare, professionals in creating public awareness and encouraging vaccination is now even very critical. Can you give us insight into, IMASA's strategy for engaging with healthcare professionals and, community members on how they can best promote vaccination within their communities?
Sure. No, that's extremely important. And the Islamic Medical Association, besides producing this sort of information with its concern and relevance to the community, we have a lot of educational programs which the organization conducts through webinars, what called uh, CPD activities, conferences, and education in terms of general to the public as well as the healthcare professional through these meetings and through the publications. So that's what we do as an organization to try and create an awareness and provide information about a particular condition like this one, which is very serious, highly contagious, and causes a lot of damage in terms of morbidity and mortality.
Hmm. And in situations where there is, limited awareness or low uptake of the measles vaccine in certain communities, what measures can IMASA or healthcare systems or professionals take to mitigate this gap?
Okay, the importance for the healthcare workers is first to understand the disease and its implications in terms of complications, etc. And once they understand that, then we know that the disease is very contagious. If one individual is infected, it can infect another 10 or 12, much more infectious than any other respiratory illness. So the knowledge first is about the seriousness of the disease, and then we know that we do not have any treatment for it. We do not have, we only try and treat the symptoms. And if there are complications, again, that becomes very difficult. So the only thing we have in terms of preventing the disease is vaccination. Now, healthcare workers, we have the community, and there is a fair amount of respect for the healthcare community. And in that way, we can encourage the people in general and the population, as well as our communities, to take the vaccine and be immunized. Because once you are taking the vaccine, even if the individual gets infected, the disease won't manifest in a severe form. So that's very important.
Most definitely, that's a very important point that you've raised there. Now, given the concerns around the cost and availability of the Priorix vaccine, what measures would IMASA recommend to increase access to more affordable options?
Yeah, now this has been from many years the problem with the community, the Muslim community specifically,
Mm.
is about what are the constituent in the vaccine, and the concern has been in terms of a stabilizer, or what they call expedient, in terms of what the vaccine has, as extract of gelatin. Now, this is not new. This has been there for years now, for the last several years. And we have discussed this, I mean, worldwide. We have Islamic medical associations throughout the world, in all different parts of the world, about 40 other countries. We've discussed this with the ulama internationally. We've discussed it locally. And the consensus of the opinion is that if there's no available alternative source, and if the vaccine is of proven efficacy, it works, and there is no obliteration. There is obliteration. Sorry, not no. There is obliteration, and the ulama call it istiqlal of impure substance during the manufacturing process, to the point of being not traceable, and it's being transformed. Then the vaccine is acceptable. So that is an opinion which the majority of the ulama worldwide, etc., have. So from that point of view, there shouldn't be a concern of any of the vaccines that are available. However, then you're going to get some people who are very or ultra conscious, whatever. Then the one that does not label it to have any gelatin of questionable source is the Priorix one, which again is expensive and may not be available. So in terms of the vaccine, all the vaccines are acceptable from a consensus point of view from the ulama. So I don't see a problem there, and I think that's what the advice we are giving to the Muslim public.
Jazakallah so much for sharing that with us. Now, as South Africans' population is diverse, how can IMASA's messaging around measles vaccination be tailored to different religious and cultural communications? I mean, communities, to ensure that everybody has access to this vaccine and everybody is, also taking measures, but we are also culturally sensitive to the information.
Yeah, I think that is from a IMASA, or from an Islamic point of view, we share our information, we share our sources, etc. And I think from what we know from all the religions, whether it's Christianity, Judaism, etc., they don't have an objection to vaccination per se. So hence we encourage vaccination,
Mm.
and we have where sometimes there's a problem, we facilitate and we help the Department of Health. A point in, I must mention, this happened a couple of years back. There was a family in Pretoria that was infected in terms of they hadn't taken the vaccine, and they were sending the children to school, etc., and it became a problem in terms of affecting others. And there was a lack of understanding, and there was this sort of vaccine hesitancy. So one of our community health doctors went to the family, discussed the vaccine, discussed the measles, the disease, etc. And once they understood, the family then were quite obliged. I mean, they were obliging in that they took the vaccines, then they prevented the children from going to school while they were infected, and hence prevent the spread of the disease in the community. So in that way, we play a role from that point of view, and that is one case. And there have been other cases in the country where the members of the Islamic Medical Association assist in educating and facilitating the public and the communities, whether they're Muslim or not, in terms of the importance of vaccination and the importance of not spreading the disease to others who are vulnerable. Now, there may be the other issue. Sometimes people feel that this is not a thing; it doesn't affect me, etc. But there are cases where infected children they come to the household if they're not vaccinated, and in the household there may be some cancer patients, there may be some elderly patients, parents or grandparents, etc. And if they who are on chemotherapy, etc., on medication that suppresses the immune system, and if they get infected, and then it's quite fatal, can be fatal. So
Mm.
it's important in terms of not preventing it spreading in the community as well as in the household.
Mm. Now, Professor Anwar, as we conclude our discussion, could you, provide us with an outlook on the future of measles vaccination in South Africa? What are the opportunities for improvement?
Okay, now that's if you're talking about a national issue,
Mm.
that's a big question in terms of a public health question and
Mm.
in terms, again, of understanding the disease. Now, measles, the disease, it affects primarily infants, that is, children under 1 year of age, primarily. It doesn't mean it doesn't affect others, it affects others as well. But it affects them, that's where it has a big damage. So that's why the vaccine program is designed to give the vaccine early at 6 months and then a dose later. So that we know the disease is serious when the children are very young. Now, what we also know that one dose of the vaccine has an efficacy of about 85%. So even if 100 people get it, 85% of the people will produce antibodies, that is, antibodies against the virus, and help them protect it. 15%, in spite of receiving the vaccine, will not mount an immune response. So that's a limitation of the vaccine in terms of how it interacts with the human body. Now, in order to get protection, one needs to take a second dose. So two doses will give an efficacy in the region of 95%. So the two doses of the vaccine are very important. One dose will give partial immunity, not that, but 15% will not get immune response irrespective. So the importance is one to understand that of the disease, the vaccine, what it can do, what it cannot do. With that, now the second part is you have to give the vaccine to the population. So if you're talking about South African outlook for South Africa, the vaccine coverage has to be more than 95% in the country. That's mean 90% of the children who are under 1 year must get the vaccine. And that is if people are not coming for the vaccine, or if because of the socioeconomic conditions, they are not able to get a vaccine, that creates a problem. And that's why we get these outbreaks from time to time, because we don't have a vaccination program that is more than 80% or something that South African figures are, and we don't take the second vaccine. So if we want to look at what we need to do for South Africa, we've got to improve our vaccine coverage. We've got to get the vaccine to more people, 90, 95% of population of the children that are born within a year, and they get the second dose. And we have to see that we cover all areas of the country.
Mm. Jazakallah so much for joining us, Professor Anwar, and just for giving us insight on, the importance of vaccination and, the measles breakout itself for those who did not know, but most importantly on also just applying, a lot of knowledge on why it's important to have healthcare professionals and community members educate themselves on the importance of taking vaccination. So Jazakallah so much for your time. Viewers at home.
شكرا جزاكم الله خير السلام عليكم ورحمة الله وبركاته.
Wa alaikum salam. Viewers at home, that was Professor Anwar Hoosen, who is the IMASA representative, and he was talking about, what IMASA is doing in terms of taking measures to ensure that people are informed on vaccination and the importance of vaccination, especially amidst the measles breakout. But without wasting any time, we are going to head out to a quick break. We are still with you after this, so stay tuned.